Hello, and welcome. Today, we're diving into the complex world of heart health to understand a condition called unstable angina. It's a type of chest pain that signals a serious heart problem, and knowing the details can be crucial for your health and the health of those you care about. So, what causes this unstable angina? In most cases, it stems from a buildup of plaque within the coronary arteries, a process known as atherosclerosis. This plaque, made of cholesterol and other substances, narrows the arteries, restricting blood flow to the heart. When this plaque becomes unstable, it can rupture, leading to a blood clot formation. This clot can partially or even completely block the artery, causing the pain we associate with unstable angina. Now, let's look at the pathophysiology. When a coronary artery is partially blocked by a blood clot after plaque rupture, the heart muscle doesn't receive enough oxygen, rich blood. This lack of known as ischemia causes chest pain. Unlike stable angina, where the pain is predictable and relieved by rest or medication, unstable angina occurs at rest or with minimal exertion. The pain is more severe, prolonged, and doesn't respond as readily to standard treatments. The imbalance between oxygen supply and demand in the heart muscle is the core problem. Unstable angina is a significant public health concern. It is commonly encountered in emergency rooms and cardiology clinics worldwide. Individuals with pre-existing heart conditions such as coronary artery disease, high blood pressure, high cholesterol, diabetes, and those with a family history of heart disease are at higher risk. It's important to note that the prevalence can vary depending on factors like age, ethnicity, and lifestyle. Recognizing the signs and symptoms is key. The most prominent symptom is chest pain or discomfort, often described as pressure, squeezing, or a heavy feeling. This pain can radiate to the left arm, shoulder, neck, jaw, or back. Unlike stable angina, the pain may occur at rest, be new in onset, or become more frequent, severe, or prolonged than previous episodes. Shortness of breath, sweating, nausea, and dizziness can also accompany the chest pain. If you experience these symptoms, seek immediate medical attention. Diagnosing unstable angina involves a thorough medical evaluation. This typically includes an electrocardiogram, or ECG, to assess the heart's electrical activity. Blood tests are performed to measure cardiac enzymes, like troponin, which are released into the bloodstream when heart muscle is damaged. A stress test, where the heart is monitored during exercise, might be conducted to evaluate blood flow. Coronary angiography, an invasive procedure involving injecting dye into the coronary arteries, can visualize blockages and their extent. While there aren't distinct types of unstable angina in the traditional sense, it can be classified based on its severity and the circumstances of its occurrence. For example, it can be described in relation to its cause, like being caused post-surgery. It may be described by when it happens, like prinzmetal angina or variant angina, or it may be related to whether it is new or old, increasing frequency, or refractory to nitroglycerin. These classifications help guide treatment decisions. Treatment for unstable angina aims to relieve symptoms, prevent a heart attack, and improve long-term outcomes. Immediate treatment often involves medications such as aspirin, nitroglycerin, and antiplatelet drugs like clopidogrel or ticagrelor to prevent further clot formation. Anticoagulants like heparin may also be used. For more severe cases, procedures like angioplasty with stent placement or coronary artery bypass graft surgery might be necessary to restore blood flow to the heart. Lifestyle modifications, like quitting smoking, adopting a heart-healthy diet, and regular exercise are also crucial. Prevention is a cornerstone of managing heart health. Control your risk factors by maintaining a healthy weight, eating a balanced diet low in saturated and trans fats, cholesterol, and sodium. Engage in regular physical activity. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Don't smoke, and manage underlying conditions like high blood pressure, high cholesterol, and diabetes. Regular check-ups with your doctor are vital for early detection and management of risk factors. The prognosis for unstable angina varies depending on the severity of the condition, the presence of other health problems, and how quickly treatment is received. With prompt and appropriate management, the risk of heart attack and death can be significantly reduced. Ongoing research is focused on developing new medications and minimally invasive procedures to improve outcomes for patients with unstable angina. Newer antiplatelet agents and more advanced stent technologies are constantly being evaluated. Genetic research is also exploring the role of genes in influencing the risk of unstable angina. It's a rapidly evolving field, offering hope for improved diagnosis and treatment in the future.